Is it time for a tummy tuck? It's a question many women think about, and Dr. Douglas Grace is here to tell us about the procedure and what to expect. This is Daily Web TV. Today I'm here speaking to Dr. Douglas Grace from the Grace Clinic. Dr. Grace, today we're talking about tummy tucks. Can you explain to me what this procedure is?
Sure. A tummy tuck is a surgery where we remove the lower abdominal skin and then we tighten the muscles all the way from the rib cage down to the pubic bone. So it tends to be best for women that have given birth and still have a lot of that lower pouch of skin and have a lot of looseness in their upper abdominal muscles.
Is this a procedure that we would all expect the same results at? Like, if I get a tummy tuck, am I going to look exactly like that, maybe that model and that I want her tummy, I want the six-pack, I want all that?
A lot of it depends on your underlying body structure. The most important thing is when you're being examined, what we want to check is, one, is the muscle separated? So we lie you down and we have you do a sit-up and feel if the muscle is separated. Then we want to see how much excessive tissue you have on the lower abdomen. And we also want to see how much fat do you have, because some people have a lot of fat, so they have a thick abdominal wall, and some people have thin fat, so they have a thin abdominal wall. So generally you want to be in the best shape that you can be so that we can give you the best possible result.
Is there alternatives to a tummy tuck? I'm a little, when you say you're taking a big chunk or you're opening up a big chunk, that's really intimidating.
Yeah, so there are alternatives. Tummy tuck really isn't that invasive as people think. It's really probably 15 to 20% of what a C-section is, and a lot of people don't really worry about C-sections. Because even though we're doing a lot of work, it's still very superficial. So the vast majority of patients go home either the same day or the next morning, and they really have relatively minimal amount of pain. What's involved is we're just removing the lower abdomen. We do some dissection up and tighten your muscles so that we make you nice and flat, but it's really just a small incision just down in the pubic area that we extend a little bit laterally so that we get a nice tight abdomen.
What's the recovery period? Is this something I can get done on a Thursday, be back to work on a Monday and show off my nice new stomach?
No, generally when you have any surgical procedure, you need to take some downtime. And the downtime tends not to actually be for your pain. It's more that you actually just let your body help it to recover. So we usually tend to tell our patients, you probably need at least 1 week off of work and then really no exercise for 3 weeks. The reason we don't want you going back to exercise is that you can increase your blood pressure from the exercising and the activity, and that can increase your bruising and swelling. And that's really the most important thing, is that if you're going to invest in your time in having a tummy tuck, you want to get your best possible result. And that really means that you just need to take it nice and easy, and you should have a great recovery. And we just really like to see people nice and close at the beginning to make sure that you're right on the right path to recovery and that there's no issues. We tend to take close monitoring of our patients quite seriously.
Is there a common myth that you want to clarify about a tummy tuck?
Well, I think the common myth is that it's actually a very involved procedure with 6 to 8 weeks of downtime and you're in bed. The vast majority of my patients, they go home the same day, they're up walking around at home, and most people feel that they could be back to work within probably 4 to 5 days. Some of my nurses that I've done were out shopping at day 5. So it's really, I think, with a lot of the new technology and the way we have for pain control, it's not that painful, and they really get great results quite quickly. So I think that it's a great procedure with really not a lot of downtime.
Where can somebody go to get more information on the procedure of a tummy tuck?
So the procedure, the best information they could probably get is going to our website, where we give a lot of information, some drawings. There will be some videos on the examination and what exactly is involved, in some patient testimonials.
Great. Well, thank you very much.
You're very welcome.
For more information on Dr. Grace and his clinic, visit his website. Connecting you to your local community, I'm Tracy Bizot, and this is Daily Web TV.